Breast cancer is one of the most common cancers of the women folk of India at this point of time. Earlier we used to call cervix cancer as the commonest disease, but if you now look into the statistics and if you look at the cancer registries, breast cancer is probably the number one cancer for women in urban registries. For the rural cancer population, of course, cervical cancer remains the mainstay, but breast cancer is slowly picking up in those areas as well. Breast cancer is a very common disease in the sense it is found in most of the women folk in our city, and it forms as a painless lump. And breast cancer not only is diagnosed in every lump the patient has, but majority of the breast lumps will come as a benign disease. So whenever you have a lump, don't feel that you have got cancer. 80% of your lumps are not going to be cancer. It is only 20% of those lumps which are going to be cancer. So how does breast cancer occur? Breast cancer occurs by certain statistics which shows that breast cancer occurs in those who has not been breastfeeding their babies, who are nulliparous, who doesn't have given childbirth, who has a very short menstrual history of late menarche and early menopause, and of course those who are in the habit of taking oral contraceptive pills and hormone replacement therapies and so on and so forth. Alcoholism, obesity is also a part of breast cancer etiology, and of course 15% of breast cancer occurs in those who have genetic risk running in their family, which is called BRCA1 and BRCA2. 85% of breast cancer, of course, is sporadic, and so you don't need to think that it runs in your family. But you must be careful if somebody near and dear ones in your family has a breast cancer. Breast cancer is very easily diagnosed. Breast cancer is diagnosed because you can palpate it very easily, you can detect it, and you can do by a simple needle test or a crooked biopsy, you can diagnose breast malignancy. Ultrasonography breast, mammography of the breast, MRI breast are important investigations to diagnose breast cancer. Breast cancer is often detected early because if you do not ignore it, because when you find a lump, if you go to your doctor can easily find out whether you are having breast cancer or not, and you can diagnose. Problem starts when you often ignore it and you take recourse to alternative therapies and the breast lump increases. The investigations for breast cancer is also pretty simple, but breast cancer also has a varied prospects. Not all breast cancers are aggressive, not all breast cancers behave the same way. So there are some breast cancers who are called ER/PR positive or estrogen and progesterone receptor positive, or the so-called luminal A, who are very indolent variety of breast cancer and can be treated very easily. There are other breast cancers who are very aggressive type, or calling the triple negative breast cancer varieties, or the HER2 overexpressive breast cancers, who actually needs much more aggressive treatment. The treatment for breast cancer essentially remains a combination of surgery, radiotherapy, chemotherapy and hormone therapy, and now of course the biological therapy of targeted therapy. Surgery can be removal of the entire breast or can be removal of just a small lump and the axillary lymph nodes, which is called breast conservation surgery. Radiation is often required in most of the situations if you are node positive disease, or if your breast is being conserved, or if you have been diagnosed with a locally advanced breast cancer. Chemotherapy is a mainstay of most of the breast cancer chemotherapy, breast cancer diseases, and you require chemotherapy in most of the situations. Hormone therapy is a very useful treatment when you are ER/PR positive. I was talking about HER2 overexpressive disease, where you can use targeted therapies like trastuzumab, where it gives additional survival advantages. Treatment is normally long for breast cancers. The minimum duration of treatment is around 6 months. If you are HER2 overexpressive, the treatment can go on for over a year. Early breast cancers are treated with surgery followed by radiation, chemotherapy, hormone therapy. There is a group of breast cancers called locally advanced breast cancer, usually stage 3 breast cancers. Early breast cancers means stage 1, stage 2. Stage 3 breast cancers are treated essentially by giving chemotherapy up front and making the disease down, and then operating and giving radiation and other hormonal treatments. And the final group is a stage 4 breast cancer, which is essentially advanced breast cancer, where we do not talk of cure. We talk of cure all through in stage 1, stage 2 and stage 3 diseases, but in stage 4 diseases we essentially do not talk of cure, we talk of palliation, where we give chemotherapy, we give hormone therapy, we give sometimes radiation, sometimes surgery is also taken into account, and the essential goal is improving quality of life in those group of patients. Treatment is essentially long term for breast cancer. For advanced breast cancer, you need to carry on every time with treatment, have a treatment holiday period, and then go on. Expenses are much more when you go for long-term treatment. I would suggest that if the breast cancer is diagnosed early, your treatment is very short and your curability is very good and the treatment is less expensive. And as you get diagnosed in an advanced stage, your treatment is prolonged, the outcome is poor and the costs become enormous. Chemotherapy, we use chemo port for breast cancer because one of the hands on which side the surgery is done is often not used for chemotherapy. So chemo port is a supportive way of giving chemotherapy where a portacath is inserted into your chest wall and we give chemotherapy through it. It's a very useful way of giving chemotherapy. Breast cancer has come a long way. Earlier, this breast cancer used to be found incurable, and now we are having long-term survivors in breast cancer. And with your support, with your awareness, with your help, I think we'll be able to overcome and conquer breast cancer very shortly.